Hello and welcome to Spotlight on Wawarsing. Today is Thursday, December 13, 2018. I'm your host, Alana Logan. Today's show features Victoria Reed, Executive Director for Ellenville Regional Rural Health Network. Thank you for being here.
Thank you for having me.
So we have some questions for you today. What is cardiovascular disease?
So cardiovascular disease is also called heart disease a lot of times. It basically encompasses heart disease, which could be heart attacks, heart failure, having heart arrhythmia. That's when your heart beats at an irregular rhythm, so it might be too fast or too slow, or if you have heart valve problems. Or it could be stroke, whether it's a ischemic stroke. That's what happens if you have a blood vessel in your head burst. Seems like kind of a depressing topic today, but we'll move to funner stuff later. Or it could be a hemorrhagic stroke, and that's when you have bleeding in the brain as a result of burst.
Why is Ellenville Regional Rural Health Network focusing on preventing cardiovascular disease?
Sure. So aside from the reasons that I just talked about, having things burst in your head is a pretty good reason to prevent cardiovascular disease. Cardiovascular disease is actually the main leading cause of death in the United States. So it kills the most amount of people other than anything else in the United States. So about 11.5% of adults in the United States have been diagnosed with heart disease. So that's about 28.1 million people. So data's kind of boring, so I'm going to try and put it in perspective a little. So how many people do you think live in New York State? How many million?
2 million.
No, actually 19.8 million.
Okay, I'm so off.
So more people in the United States have heart disease diagnosed already than live in New York State. That's the same number as actually the second most populated state in the country. So just for fun, do you know which state that is? You want to guess?
New York? I don't know.
Texas.
Texas.
So Texas is about 21 or 28 million people, and that's the same number of people that have diagnosed with heart disease. So like I said, it's the leading cause of death every year, and so it results in about 600,000 deaths per year. And so again, to put it in perspective, because numbers don't mean a lot, that's like the entire city of Boston. Everyone who lives in Boston dying every year of just one disease. So it's a pretty big deal. And it's also a big deal locally too. So from 2008 all the way to 2015, it was the leading cause of death here in Ulster County as well. Locally, about 30% of adults have high blood pressure, which is kind of the first thing that happens before you develop heart disease. So at the Rural Health Network, we developed a program to try and prevent people from developing heart disease. So we're looking at some of the risk factors before you develop heart disease, so we can prevent those deaths from happening locally.
How can you tell if you're at risk for developing cardiothoracic disease?
So some of the risk factors are having high blood pressure, like I mentioned, which is about 30% of the people who live in Ulster County. And one of the tools that you can actually use is this heart age calculator that was developed by the CDC. So the website address for it is really long. The easiest way to get to it is just Google heart age calculator, and the first result that comes up you can click on. It'll take you right to it. And then you'll go through and input some information, and it'll tell you what your risk levels are. So this calculator works for people who are between the age of 30 and 80. So I'm just going to plug in some fake information since you're not 30. So if we said we had a female who was 34 and 5'7", and weighed about, let's say, 180 pounds. 180 pounds, and let's say their systolic blood pressure. So when you get your blood pressure taken, the systolic blood pressure is the top number. Have you ever had your blood pressure before? So they give you the 120 over 70 or something. So the top one is your systolic blood pressure. So let's say this person has 156, which would be a little high. And this person doesn't take blood pressure medication, but they do smoke cigarettes, and they don't have diabetes. So all three, smoking cigarettes or having diabetes would also be things that put you at a higher risk of developing cardiovascular disease. So we would calculate this and say, this person whose information we just made up, they actually have a heart age of 56. So their heart age is a lot higher than their actual age. And they have a 6% chance of experiencing a stroke or a heart attack in the next 10 years.
Wow.
So this here it says, smoking is increasing this heart by at least 9 years, and quitting would help lower it, and the weight is also increasing it. So it's a good way to kind of look and assess if you're at risk of developing cardiovascular disease in the future. You can also talk with, your primary care doctor, can help you give some information about that. Or, if you really don't know, you can come talk to us at the Rural Health Network.
What is the Healthy Hearts program?
So the Healthy Hearts program is the program that we started to help prevent cardiovascular disease in our area, in the Wawarsing area. And so what we are looking to do is recruit people who are at risk of developing cardiovascular disease to come and join our program. And then we offer a number of different activities and events to help prevent developing cardiovascular disease. So people who enroll in our program will be assigned a community health worker. And the community health worker can make home visits or meet them in the community, talk to them about their needs, and get them enrolled in programs. And then we offer a number of programs like walking groups, lifestyle change programs, cooking classes, cooking demonstrations, a whole bunch of different things that can help you lower your risk of developing cardiovascular disease and all those kind of scary data numbers that we talked about.
How does Healthy Hearts program work exactly? How does it help to prevent
So once you enroll in the program, you'll sit down with the community health worker and they'll take you through an intake assessment. They'll look over your numbers, some of the clinical measures, like what your blood pressure is, what your weight and your height is, if you're smoking, if you have diabetes or other chronic conditions. And they'll help work with, she'll help work with you. Our community health worker's name is Shanna. So Shanna will help work with you to kind of come up with a plan to help get some of those numbers under control. What kind of activities you can sign up for, and she'll let you know all the things that we have going on, the different classes, we do grocery store tours, all kinds of things, and she'll come up with a plan for you to, reduce your risk.
Who's eligible for the program and how do you sign up for it?
Sure. So anyone who is at risk of developing cardiovascular disease but hasn't yet developed cardiovascular disease can sign up for the program. So if you live in the Wawarsing area and you don't have cardiovascular disease, but you have any of the kind of indicators where you talked about high blood pressure, diabetes, if you're a smoker, if you feel like you need to get a little bit of better handle on your weight, anything like that, we'll take you through a screening to make sure that you're eligible. And then we'll sign you up. And so the first appointment takes about an hour and a half, and Shanna goes through those clinical measures and some kind of intake questions. And then after that, she'll probably follow up with people who are in the program once a month, once every other month, depending, how much time with her they need.
Okay. And how can people find more information or events on the Rural Health Network?
Sure. So the easiest and fastest way to find out about the information, two ways would be the website, the Ellenville Regional Hospital website. So the Rural Health Network is embedded in the hospital. So if you look at our website, you can find information about our upcoming events. There's an events calendar there. Or you can call Shannon Nigro, our community health worker, directly. She's at the hospital number, so if you call the hospital and you just ask to speak with Shanna, they'll transfer you, or you can reach her at 647-6400, and she's extension 336.
Was there anything else you wanted to add to the whole?
Sure. So we have some new events coming up, and those events are open to the entire community, so you don't have to actually be signed up for the cohort to join some of the events. So if you're looking at the events and you find one that's interesting, you can come to it, even if you're not part of the Healthy Hearts program itself. So one of the things that we do is a grocery store tour. So we go to the grocery store and we walk around the perimeter and we talk about, healthy food options versus boxed food and things like that. So if those kind of things interest people, they can come. It doesn't have to be just people in the program.
What type of healthy foods do you show?
So the last time we did it at ShopRite, and they actually had the distributor from Palm Wonderful come, and they actually like cut up a pomegranate and let everyone taste it. A lot of people don't know how you would cut a pomegranate up. Have you ever seen a pomegranate?
Yes, I see.
Yeah, so the first time seeing it is probably a little like, what do I even do with this thing?
Yeah.
So that was a really cool thing. And then so they went around the outside edge. So they looked at all the vegetables, produce, fruits, meats, and talked about, what's healthy options to buy.
It's pretty cool.
Yeah.
Yeah. I would love to go on that. I need to do some healthy eating, even though.
Yeah, give us a call. You're welcome to come.
Anything else?
The only other thing I'd love to throw in there is every day at 1 o'clock we do a walk from the hospital. So if you're in the community and you want to get a little bit of exercise, you can meet us at the hospital lobby at 1 o'clock. We go for about a mile walk just to get a little exercise in. And that's open to anyone who wants to join us.
And where does that walk consist of?
So we walk, we meet the hospital lobby and we walk around the back of the hospital down to Airport Road, and then we walk down Airport Road. So we do that at 1 o'clock every day, and then we also do a walk on Thursdays. Every Thursday at 10 a.m. we meet at the library. We go for about a mile walk around town, and then we have some type of health topic after it. So sometimes we do cooking demonstrations or chair yoga. One time we did gong meditation. So all different types of topics about living well.
Okay. That's it.
That's it.
To sign up for the program, contact Shanna. What's her name? Shanna Nigro, community health worker at Ellenville Regional Hospital, by calling 647-6400, extension 336. And for more information, you can email vread@ellenvilleregional.org. Thank you for joining us for this episode of Spotlight on Wawarsing. See you next time.